Well, what Wes was saying is that there are deep problems in the NHS now. I often say the NHS is on its knees. Most people working in the NHS say, no, Keir, we're on our face. So there's a huge number of problems caused by 12 years of mismanagement. Waiting lists were too high before COVID. We've got staff shortages left, right and centre. Morale is rock bottom. So there's the stuff that we need to do to rebuild the NHS. But Wes was also talking about what we need to do going forward, which I agree with, which is, of course, there's always going to be the question with the NHS about the money that's needed, but we also need to reform. We need intervention, we need prevention, we need to change the model. We've been here at this hospital looking at robots of the future and how they're going to help us with operations. So yes, we've got to give the NHS the support that it needs, but also with an ageing society, we're all living longer, this is a good thing. We need to change the model to make sure that we reform the NHS as we go forward. Well, what he was saying is we need to reform and we need to work with the NHS on a sort of can-do attitude as we go forward. We're going to have to put health closer to people in their communities, particularly mental health. We're going to have to use technology in a completely different way and data. We need to take the health service with us on that. Now, of course, the Labour Party, set up the NHS in the first place. We're great supporters of the NHS. When we were last in power, we had fair pay for nurses and we didn't have nurse strikes. So the NHS is always safe in Labour's hands, but we've got to be honest. We're going to have to change the way we operate going forward because, as I say, we're all living longer. We need preventative, we need early intervention, we need to use that data, that technology in a different way. I think this is very exciting, but it will mean change. With the NHS, we do this every year. I have an interview with you and others, and you say, what are you going to do this winter? We say we're going to do this winter, but the real issue is the staff down the line. We've got to train more staff. And you say, well, I'm not interested in that. It's going to take too long. We've done too much sticking plaster politics, I'm afraid. We've got to look to the future. We want to get rid of the non-dom tax status and use that money to train 15,000 medical students a year, 10,000 nurses, and 5,000 district nurses. So staff in this hospital need to know the cavalry is coming. They need to know that we understand that staffing is the key issue. This morning we've been talking to nurses, to trainee consultants, and all of them speak with one voice in saying the problem is, Keir, we don't have enough staff. We've got to confront that. And we need to send a message, because morale is very low in the NHS. The cavalry is coming under the next Labour government. We will have those staff in place to support you and what you're doing. For the government to say there's going to be a strike on Thursday, we're not even prepared to talk between now and Wednesday to avert that strike. It's a colossal failure of leadership. Across the piece, everybody watching this will be expecting a responsible government to go in and to negotiate. And how else is this dispute going to be resolved? When I was Director of Public Prosecutions, I had 7,000 staff, I had 2 trade unions, and we resolved things around the table. That is leadership. This will not be resolved unless we see leadership, and leadership is what we're missing from this government, which is very happy to sit on its hands and blame other people and not do what leaders should do, which is get in the room, negotiate and resolve this issue. Well, we're heading for a strike on Thursday. Nurses going on strike for the first time. They do not want to do that. My wife works in the NHS, my mum was a nurse in the NHS, my sister was a nurse in the NHS. I know what it's like for nurses in the NHS. They do not want to take this action. They've said to the government, let's see if we can resolve this between Monday and Wednesday. All you've got to do is to walk into the room and talk to us. I don't think anybody watching this would say it's responsible government to say, no, we're not going to do that. We'll sit on our hands. We'll let that strike go ahead.